So you may have noticed that in today's day and age, sometimes it feels like holistic healthcare and allopathic medicine are almost two separate fields with their own sets of practitioners, their own sets of rules, their own code of ethics and everything. While these two fields feel separated, they haven't always been. They are not in many other countries, and they don't always need to be separated. And that is the ultimate message of what I'm sharing with you today. Before the 1900s, holistic healthcare actually used to comprise anywhere from 50 up to 100% of medical school curriculum. It is very standard practice to use herbs and botanical medicines and sound therapy and phototherapy and electrotherapy and all these different forms of healing when it comes to people's health. In the 1800s is when scientists started discovering pharmaceutical drugs. They said, hey, you can take an extract or you can take a property of a plant or of a fungus, and you can chemically synthesize that in a petroleum derivative. And what that gives you is a more reliable dose. When it comes to plant medicine, depending on the composition of the soil the plant was grown in and the climate and the other plants around the plant, all these things impact the chemical composition of a plant. And so you have a lot of variability sometimes plant to plant. With a pharmaceutical drug, if every time I take a pill, I'm getting 10 milligrams. That's much more controllable and reliable in the clinical setting when you're establishing dose exposure and dose thresholds. The other main quality of pharmaceutical drugs is that they are patentable because it takes a lot of research to be able to chemically synthesize that. So now you have this highly profitable substance that's now coming up to bat against some of these unpatentable, widely accessible things that many of us can grow in our own backyard. At the turn of the 20th century, so the early 1900s, we see the American Medical Association, highly backed by the Carnegie Foundation, start to step in and wanting to play a larger role in U.S. medical education reform. And Rockefeller also contributed lots of money to a general education board that would fund schools that complied with the regulations coming out of these associations. So one thing that the AMA and the Carnegie Foundation did is they hired a gentleman named Abraham Flexner to go around and survey all the medical schools in America and conduct an analysis and a report. This report actually contains several great suggestions about the quality of education physicians were receiving, about how much they need to know before they can graduate and even come into school, and about how much they need to use the scientific method and use these very scrutinous research methods in their schooling and in their practice. There were some great recommendations that came out of the report. However, there were also some devastating recommendations that came out of the report, including some racist and sexist clauses, as well as clauses that required medical schools to remove 100% of naturopathic therapies from their curriculum in order to focus on the advancement of modern medicine, aka pharmaceutical drugs. So the report said, hey, medical schools, if you want to receive funding and accreditation, you need to remove naturopathy, osteopathy, some of these botanical medicines, electromagnetic therapies, phototherapies, hydrotherapy, different forms of psychotherapy, all these homeopathy, all these forms of healing had to be completely stripped from their medical curriculum. The physicians could no longer be taught how to use these different forms of healing with their patients and in their patients' healing journey so that they could focus on the clinical advancement of modern medicine. So as you can tell, this has had devastating effects on what we want to call integrative healthcare, where now we have allopathic medicine almost practicing in a bubble and then holistic healthcare practicing over here, when these two fields would ideally be working together, and now they're in these two separate spheres. This is so relevant because in today's day and age, a lot of people look at naturopathic therapies and they're thinking like, hey, if it worked, I would be hearing about it. If it worked, I would be seeing it used in hospitals. If it really worked, I would be seeing the clinical trials. And I always mention these people, first of all, you have to understand the history that these forms of therapy were systematically removed from medical school curriculum 110 years ago. It hasn't been taught to our healthcare and our public health professionals in over 110 years. So no wonder the policies and the protocols we come up with today are not as integrative as they can be and will be. The second thing we have to look at is the cost of performing clinical trials on any form of healing. We're looking at an average of $20 million for a phase 3 clinical trial. If you're putting a patentable, profitable pharmaceutical drug up to bat against a holistic therapy that people can access in their own community, there is going to be a very different return on investment in these two research proposals. And that is a huge driver of our research agendas in the 21st century. We have all these forms of naturopathic care that we can be using in our individual practices and with our clients and with our patients. So we do have a system that systematically preferences certain forms of therapy over others. You can see the impact of this today, where you have a country, the United States of America, currently using 41% of the world's pharmaceutical drugs, and we are only 4% of the world's population. This is the vision I share with you of tearing down some of these barriers so we can reintegrate these fields of healthcare to use modern medicine when we need it and to use naturopathic medicine when we need it. And we're going to teach you all about how to integrate these two fields of healing as you come through our school and learn the science behind natural healing, and also learn some of the amazing discoveries that have happened in modern medicine that we are personally so grateful for as founders of Holistic Health Educators. I'll leave you with this. No one wins when we try to separate and ostracize each other. And as much as practitioners in the holistic healthcare field may have valid reasons for feeling some frustration towards what has happened to this field, and while those in the medical field have valid reasons for feeling frustration at not being praised and accepted for their strong points and utilized for their strong points in moving modern medicine forward, at the end of the day, we do need to focus on each other's strengths instead of each other's weaknesses if we want to reintegrate these fields in the US and throughout the entire world. So this is our mission at Holistic Health Educators, and we thank you for coming on board.